My name is Dr. Tim Henschel, and I was the first pediatrician at Mercy Children's Clinic. Where did the idea of Mercy come from? Well, I was at a place in my training where I wasn't really sure what I was going to do. And my wife and I were youth volunteers at a meeting out in Knoxville, and they were showing a video of high school students at a camp taking care of kids with special needs. And as I watched this video, I just start crying, and I don't know why. And I just start saying, God, what are you doing here? And clear as day, he said, well, Tim, what about a clinic in Franklin with Franklin Community Ministries? In September of 1998, I sat down with Scott Rowley and kind of shared this idea of a clinic for kids. Kids who otherwise wouldn't be able to access pediatric care, and to say, hey, is this something that's really needed in Franklin? And so Scott's reply was, absolutely. We've been talking about something like this for a while, and here you are.
Tim, he got the vision for being the doctor in the neighborhood. And so we needed a place, and Drury had this place he was gonna sell or buy or something. Anyway, we're all having our meeting at First Missionary Baptist. We're holding hands and praying. And someone said, hey, they're selling a building right around the corner that would be perfect for this clinic, or a school or something. So we pile out, head around the corner, and there they are, people standing in the street making their bids on this property. So we held hands and we just began to pray. And we said, Jesus, we could use this building. So Drury comes up and taps me on the back. He said, Rowley, what are you doing? And we just said, Ralph, we need that building. And we want to put a clinic in. And he said, all right, I'm going to buy that building.
When Mercy came to the neighborhood, everybody was excited. The whole neighborhood just was so excited to have a clinic right there where they could come and get the medical treatment for their children. Even some of them came in for themselves and just said, hey, I need medical attention. And Mercy Children there in that community, it became a family to so many of us. So we're so glad that it was there.
Mercy Ministries are ministries that are geared first and foremost to meeting physical needs. Okay. So, at the core of Jesus' ministry was that he never would do miracles without teaching, and pretty much never taught without doing miracles. Why? Well, because the two actually go hand in hand. The gospel has always been about being word and deed. It's not one or the other, it's both together.
The early years of a project always bring struggles and challenges, and you're trying to find your way through it. So as a board, we were looking to define what we really wanted to be, what we really wanted to do in the community, what was the best approach. Funding was always a major issue, but luckily we had some great people step up who were very generous, and I think that carried us through. And most of all, it was people who were praying that this would actually come to fruition and be successful and have long term. So we did a lot of praying, and through that praying, a lot of results came out of it. So we were not afraid to say we were a praying board.
They come and met in my office, some of the board members, and some, maybe one or two from the community, and we said that prayer.
Praying about how are we going to raise $103,000 just to pay our current bills. When the administrator goes out to the mailbox, opens the mailbox, opens a letter, and there's a check.
Check for $100,000. And that sort of makes you also a very strong believer in prayer.
And there's just so many other stories that this is truly a God-blessed ministry.
Mercy opened the door for us to start breaking down some walls, to start realizing that we're all human beings and we're all people. And regardless of the color of our skin, that we can all be a family from different walks, from different areas, but we can all come together from the common bond.
We often say you don't find people this diverse all getting together in the same place a lot of times, and so it was a really neat environment.
We always felt like if we got somebody through the door, they would never leave. If we could just get them through the door, let them feel and see what Mercy Children's Clinic offered, then they would never leave, and that was pretty much true.
I think the thing that probably surprised us most, even in the first couple of years, is how many patients were willing to drive to come to Mercy. And we began seeing that this wasn't just something for Franklin, this was really something for Middle Tennessee.
As we talked about seeing adults, it became apparent to us that the children we were caring for It's not just a physical health problem. A lot of times there's socio-economic, there's all kinds of issues going on in the family dynamic. And you're really oftentimes just putting a Band-Aid on the problem if you're just treating the children.
It's amazing how it's grown and evolved. Obviously the clinic has continued to prosper and get better and better.
What we discovered in the process of growth was all of a sudden Mercy was not just this little clinic in Franklin, Tennessee, taking care of just Natchez folks and underserved people in Williamson County. All of a sudden we look up and we're caring for people in 24 counties in Tennessee. We're not just a local clinic, we're a regional health center, is what we are.
We are so grateful for those folks that had the vision to make healthcare available and accessible and affordable to those in the Franklin community and beyond. Without their prayer and consistent willingness to follow God, Mercy wouldn't be here right now. Their legacy has allowed Mercy to provide excellent health care for the past 20 years in the name of Jesus Christ. And we look forward to a bright future ahead.
There is an answer for health care. And it starts with every person, every human heart. You know, we believe that we're made in the image of God, and that therefore every human being counts. And I believe that every human being deserves health care. They deserve to be looked at by a doctor and by nurses and loved and taken care of. And I think the Mercy Community Health Care, it shows the way to people who think we can't do anything with health care. It shows the way.